not going to be doctors to take care of people out here, right?
What was that, Dr. Hill?
And I'll talk about that. We'll get into that because I got a slide about that. 124,000 by the AAMC, primary care specialists down 39,000, by the year 2020. Dave and I have been through medical school fairly recently. There was a, well actually not that recently, late 90s. There was a primary care initiative at that time that was sponsored by the government. How's it working? It's not, right? People aren't going into medicine anymore, and it gets worse than that, right? Oh shoot, okay, that's on the later. Oh, that's on the later slide. All right, we'll go. Actually, look, so I'll tell you it gets worse than that. The reason it gets worse, we'll talk about this a little bit. 60% of physicians right now say, I would not recommend my son, my brother, my daughter, anybody that I know to go into medicine, right? And we'll talk about some of the quotes that are leading into that problem. People don't want to go into medicine anymore, and people forget that it's a choice to go into medicine. I don't have to be a doctor. I can decide to be a carpenter, an electrician, anything else. I decide to be a physician, and if things are being pushed against us so much that it makes people not want to go into medicine, they don't. And that's the problem. People aren't deciding to go into medicine. I'll cover that a little bit more, actually, later on. So the treatment of government subsidized care, universal coverage, we don't go through universal coverage. We don't get any of this stuff. That's a little boring. They're just not doing the job. Even with their universal coverage, they're not getting universal coverage. They take themselves.
Is the primary decline because doctors feel hamstrung by the government?
Yeah, and that's part of it. We'll talk about that. Big thing, access, universal planning, public option, access. You guys say you want to get to see your doctor. What's happened in Massachusetts since they set this public option up, right? It used to be 34 days in 2007 to go see a family doctor. It's now 63 days. Right? Can't get in to see a doctor. It's a, average wait time to see any physician in Boston, 50 days. In Atlanta, it's 11 days. Oh. Wait a minute, they're not increasing their access by putting this public option in. In 2008, 1 out of 5 said they had a hard time getting in to see a doctor in Massachusetts. 20% of guys said, I'm struggling to get in to see my doctor because their plan is not doing what they're saying. And while you might have some improvement in your coverage of insurance doesn't necessarily mean access to a doctor. You can have coverage, you can walk around with a card, but it doesn't mean you can get into a doctor's office. Canada, we talked about, Canada, 5% of the population couldn't see anybody. We already talked about medical imaging and how awful it is and how long it takes. You even heard somebody mention that about the medical imaging and how long it took them to get a CT scan in Canada. We already know the outcome data about that. So, why are doctors not going into this? What's driving doctors away? I'll tell you, what got me into this? That was actually a AARP meeting. I saw the president at a AARP meeting, okay? And he was up there and somebody asked him about the hip replacement question. What are you going to tell me that I can't have a hip replacement? And the president said to that person, no, we are not going to tell you that you can't have a hip replacement. What we are going to do is we are going to educate your doctor and yourself about better ways to treat that hip. And I started to think for a second. I said, I took 4 years of medical training, 6 years of residency. I've been practicing for 5 years. I'm a surgical specialist, and I can't tell an orthopedic surgeon how to fix a hip. Right? He's had 10 years of surgical training and personal experience to do that. If I'm a surgeon and I can't tell them the right way to fix a hip, how is my government going to tell them the right way to fix a hip? It doesn't make sense. I mean, how can people not call him on that?
Is that comparative effectiveness panel that's
And it is, which is not exactly. I have that already. We'll talk about what we have already established within each of our boards that actually give us best practice policies based on outcome data, not cost data. Comparative effective research is cost data. It's looking at you as a dollar figure, not a patient. We look at people as patients. How would you rather be looked at? So listen to the wording coming out of this administration. Why would you want to be a doctor if this guy is up there saying, we're just going to take people's tonsils out, doctors take people's tonsils out just to make a little bit of cash? I mean, he really believes that? This one really fired me up. And Congressman Scott actually had a physician come up after our second town hall when I came up and asked him a question that actually said this. Again, reiterated this. Physicians don't want to take care of people with diabetic, with their diabetes. They'd much rather have the surgeon cut their leg off for $30,000 to $50,000. Right? Have you guys heard that quote? Have you heard him saying that?
Yeah.
It's been propagated. You know how much a physician gets paid to cut off somebody's leg to do a below-knee amputation?
$700,000.
It's in the state of Georgia, $696.10.
Thank you.
So right on. Right? So they were off by a factor of 4,500%. I mean, and what are they trying to do here? What is the point behind them saying this? They're trying to just completely knock down physicians and drive physicians. And you think this kind of talk and this kind of speak is going to make a medical student go, yeah, I really want to be a doctor. My government is up there saying I'm going to cut people's legs off just because I want to make some bucks.
But he's sitting there saying today that the AMA supports this.
AMA. So quick, I'll hit the AMA very quickly because I'm glad you brought that up. You guys have any idea how many physicians are right now in the AMA? What percent of physicians?
25.
17%.
Oh, really?
17%. How many of those are actually practicing physicians?
Most of them are interested.
Half of them. Half of them are practicing physicians. Half of them are medical students. Dave and I laughed about this before because you get a free book when you're a medical student. You don't have to pay to join the AMA and send you a book. So you sign up when you're a medical student. So half are medical students, half of them are, you know, and of that half are medical students, academicians, or guys that have retired. So the AMA, part of the AMA, about 8% of them are actually active practicing physicians. So they don't speak for me. All right? Our CERMO, there's an organization out there called CERMO that has 110,000 physicians, about 12.5% of the physician workforce. 92% of those guys have come out and said, we're not for this plan, we don't think this is the right way to go.
Y'all need a
So
big
the AMA,
voice.
so quickly, AMA gets paid by the government.
Y'all need a big voice. That
We need a
needs to
big
get
voice,
out
and that's what we're
the
trying to
public.
get. And that's what we're here. That's why we're here. That's the point of this. We're getting a voice, and you guys are our voice,
So
right?
you're
'Cause
saying
you're all
that
the voice.
only 17% of the doctors of the AMA are for that bill?
No, 17, no, only of all practicing physicians out there,
No,
all
licensed.
physicians, all licensed physicians, only 17% of them are in the AMA.
And only
So
80%.
83%, I don't belong to the AMA, 83% of us don't belong to the
I haven't been to the
AMA.
AMA since I
Where are,
left.
where are these
I got my
statistics
Facebook
available?
account.
Yep, yeah, exactly. What?
Where can we get those statistics?
Oh, actually, and I've got it. See this? Oh, shoot, here we go.
You can Google them.
Yeah, you can Google them, but actually, I've got a thing at the end of this. You see my little numbers here? And we might try to see about these are all references. So these are all where I got all of these numbers from. They're referenced at the end of this. They are URL websites where you can just pull up the website and it'll give you those numbers.
And then you're gonna email this
Yeah,
president?
well, yeah, that's
If
what
you
we're
leave our
talking
email,
about. Yeah,
I
we've got
gotta
email
step in
sign
here,
ups.
because actually gotta get to
Oh, yeah, I know, he's got work
We're going
to
to DC to talk to some people. But if you leave our email, your email messages, we'll get this out to you in some form or another. I mean,
Yes.
trust me, every day there's something, so there's a new slide.
Yeah,
new
we're
slides
always
to add.
teasing,
I mean, so
toying.
it's a matter of like getting it up. We want to be cutting edge with the latest data. You know, some of this stuff you guys have heard a million times. No sense
Do
spending
you
a lot
have
of time.
the slideshow on a PDF file?
We do. We can do it that way.
I tell you, we're just doing this. I mean, to be honest with you,
This is us on our free
This is
time.
us on our
like
free
11:30
time.
at night.
Yeah. We sleep very little.
We had this in line and didn't forget 90% of it, which we will.
Right, and that's it.
What we want to do is we want to build a database for this effort of people that are interested in it, so you can go to it
website,
anytime that you
yeah.
want. We're trying to come up with a website right now. We're going to go start our own website. So you guys can, you can mine for your own data and say, I remember this one article, and you want to show your cousin at Thanksgiving. You can look at it. You don't have to.
What will that be?
The website.
Yes.
We're thinking.
We're
We're
debating.
debating a name. You got one? You can email us.
That's a cool idea. Yeah, I know.
We were thinking of just calling it just two
Just two dots.
dots.
Wait a minute, Julie, are just two
What's that?
Odds and ends.
Odds and ends.
I do work in the inside of things. I'm your
Very good.
I believe very much that if there is a strong emphasis on preventative medicine,
Right. We'll talk about that.
people will not need you guys as much as
Right.
they will lead a healthy life.
Yep, and that's a
what I'm
personal
saying.
choice.
So I think that's more important than all these,
And we'll talk.
preventive medicine and all that.
So let me get to it. I'll talk about that because you're exactly right. Dave, thank you very much. He's been working all day, but he's got to work to do it. I'll just leave it for you guys. Let me know what you need. We'll talk. And this is, honestly, we've been talking on the phone. We're up to 2 o'clock in the morning. We're just kind of playing. So we're just trying to work our way through this a little bit, but we got numbers and data that we think are very important.
Doc, you said Sermo does not, 87% of.
92% of physicians in CERMO do not support this plan.
Well, where is Sermo in this whole equation? You never hear anything about it.
He's
They're
not
not
out there.
politically connected.
Yeah, they're not politically
connected.
AMA is politically connected because they actually sell things to the government. They get money from the government, AMA does. They don't make their money actually off of physician dues. They actually make their money off of selling what's called CPT codes, which are physician codes to the government. So they have actually special interest in the government in order to back this plan because, well, the government pays them money. That keeps them alive. CERMO is not held up by the government. CERMO is just an internet web-based site of active physicians that have joined CERMO, and it's just a physician voice. But he's right. We don't have a platform, and we're looking for a platform.
Did you say that 17% of physicians only are part of the AMA?
That is correct.
Or
R. So 17%
are a member
of
of
the AMA.
AMA?
83% are not. So for every single physician in the AMA, there's 4 that are not in it. So the AMA doesn't speak for these 4, right? And then you're not even sure if everybody that's in the AMA, that 17%, even believe what the AMA is saying. Why? Why are we not in the AMA? Because they do this kind of stuff. Why would I be part of the AMA if they don't speak for me? It's a self-serving group,
It's
right?
like anything in Washington, it represents their own interests.
represent
That's
their
what
own
happens with all
personal
big
interests.
groups. Whether you're a big union, do the unions represent their union members 5 times out of 10?
No.
Probably not. I mean, so this is what you guys have to fight. You got to fight through the dialogue in the newspaper. That's what we're trying to do. Push
Right.
through these stereotypical things that
Myths.
everybody's, we call them myths, whatever, that everybody's keyed on because you all know the acronyms. You all know the data. Oh yeah, AMA. Well, it's all the doctors. So it's not.
You need to get
It's
on
not
the
what
Howard
the
Kane
doctors.
show.
But we don't have a voice because we're just two ducks.
We're just two